The 95th Medical Group at Edwards Air Force Base is leading the way with its implementation of the Family Health Initiative Program, a program designed to improve the patient-provider relationship as well as encourage retention of medical professionals.
The Family Health Initiative come out of what was then the Deputy Surgeon General, now the Surgeon General of the Air Force, who was interested in finding ways to both improve the relationship between patients and providers, as well as try to retain our practitioners. We were losing a lot of them.
The Edwards Clinic was the first Air Force-wide to kick off a 6-month trial of the FHI program, and now the first, again Air Force-wide, to implement it. Part of the Family Health Initiative model links patients with one primary provider who oversees all their health care needs. Captain Dr. Sarah Clark has noted improvements since the switch to the Family Health Initiative.
Absolutely. With this model, we do see the same patients week after week. If they have any questions or concerns, they address them to us through our nurses. With that interaction, we're able to get to know them very well, get to know their concerns, seeing them back regularly, really facilitating a good relationship between us and our patients.
There are two huge takeaways. The first is that there's nothing that keeps patient care more efficient and patients safe than good communication between patients and their providers. So the idea is to make sure that patients, as frequently as we can, see the same provider. And the result is they get to know their patients, the patients get to know them, they have good trust, they communicate better, the care is better and safer. And the second part of that is our providers like it because they feel ownership over those people that they see, and they feel more committed, more comfortable, and it's even more of a family practice.
Registered nurse Linda Davis is a medical disease management nurse, a position specifically created in the Family Health Initiative model. One of her roles in supporting the team is to ensure patients with complex or chronic illnesses get the time they need with their provider.
In the FHI model, the provider has special times scheduled with the patients that might need a little bit more time. And I proactively call patients, contact them, and make sure they get that specialty appointment with the provider. In addition, when patients may need a little bit more time outside of the clinic, visit with the provider, I make sure they get the education, the training, and basically help them with breaking down any barriers that they might have when it comes to dealing with a complex or chronic illness.
So far, the 95th Medical Group reports they are getting positive feedback about the program from their patrons. And according to Colonel Ozanian, the healthcare providers are also offering positive responses to the new program.
They are. What it allows them to do is to control their schedules so that they can flex them around what their patients need, not what I or anybody else thinks their schedule should be. It also allows them, for example, to see more complex patients. So patients who maybe need procedures, minor procedures, they can schedule longer times for. So it also improves their practice, makes their practice more interesting, and again, it increases our ability to retain them into the service, which is just a win-win.
Dawn Waldman, Edwards Air Force Base, California. This has been Dateline Edwards. If you have questions or comments, we'd like to hear from you. Please send us an email at channel.6@edwards.af.mil.